Hi, this is Justin Smith for the Listen Now campaign, an initiative from Tobin Brothers Funerals, and good on them for doing it. Make sure you follow the campaign through your social media platform, the hashtag Listen Now. And today I want to catch up with someone who knows a great deal about the area of mental health. He's been dealing with it for many years. There are few people as good as this man. Professor Patrick McGorry, psychiatrist and also former Australian of the Year back in 2010. Pat, thanks very much for taking the time to have a talk to us. I'd imagine that there have been a lot of people that have been coming to you for advice over the last couple of years, particularly. What have you been saying to people?
I guess a lot of people, different types of people have been asking me for advice, whether it's been, politicians, community leaders, but the commonest group have been desperate people, including family members, parents, trying to get access to quality mental health care for themselves or their families. And that's been a surging number, particularly since the pandemic.
What is that desperation like? How do you describe that?
It's people who have got nowhere to go, basically. They're struggling or they're in deep trouble, often suicidal, with worsening mental health conditions. And yet the entry to the system, even the system that we've created with Headspace and youth mental health, is blocked because it's not built to scale. And it wasn't built to scale even before the pandemic, and with another 30% of demand on top of that, it's really overwhelmed and swamped. So the only option they have is a GP who is always looking for specialist backup and can't find it. Or they end up in the emergency department because the situation has deteriorated to such an extent that they are in life-threatening circumstances. So this is something that then you have to kind of either see them yourself, which I have done with many of these people who are within striking distance of where I can see them, or basically trying to negotiate with, services and departments that are a breaking point and are trying to make the Sophie's choice of which of maybe 4 to 6 young people they can actually squeeze into their stretched resources.
It must be so brutally hard for a professional to try to make that decision, as you described it as a Sophie's choice. They've got to make that decision. That must be incredibly hard on them.
Well, it's spoken of as moral injury because you're not providing the care that the person needs, and you're making impossible choices. And now we're seeing this happen in the general health system with COVID. That the anticipation for doctors and nurses in the general health system are going to be faced with this pretty soon, they say, according to the modelling. And it's as if they ignore the fact that we've been working in this way for years or decades, and it's suddenly become an issue for the mainstream health system. But they never had to do that before. But we've always had to do that, and it's got a lot worse under COVID. And yet, all the airplay, all the headlines are about COVID as usual and the general health system, whereas this is our daily experience, and there's no understanding or support for the mental health professionals or the patients we're trying to help.
There's something very important in that, isn't there? When and I touch some wood as I say this, that COVID disappears and lockdowns disappear and life goes back to normal, those things will still exist. Those troubles for the professionals and those waiting times and those services will still exist. And, maybe there'll be plenty of people and politicians and bureaucrats that will sort of, sigh, relief and say, well, look, that's good, we're out of the woods. But that's a really good lesson for us, I think, isn't it?
Yeah, well, I mean, we were already in that situation before the pandemic. So even if everything to do with the pandemic settled down, the mental health consequences actually won't. They'll continue for some months or years after the pandemic stops, as the modelling shows, because the consequences, the lead time for mental ill health consequent upon the pandemic is long. But even if that were to disappear overnight, as you say, we were already turning away 3 out of 4 young people from our services even before the pandemic. So I hope in Victoria the Royal Commission will begin to fill that gap, and I'm confident that will begin to happen. But I'm worried about the rest of Australia, where that commitment has not been made, and we need the federal government to step up substantially from their side of the river to make this bridge.
Yeah, absolutely. For young people now that are caught up in this, as we are all caught up in this, I guess they can't see an ending. You know, even if we're told that, you know, look, everything will get back to normal, we still can't kind of see that yet, that ending. That must be very difficult for young minds. It's difficult for older minds, but difficult for young minds to try and process that.
I think that was a massive problem, which has been helped a little bit by the Victorian Premier's press conference yesterday. And I think the New South Wales government's been a bit ahead of the curve there by actually saying we are not going to continue this beyond a certain date. You know, lockdowns will stop, you know, once the certain level of vaccination is reached. And, you know, you're still seeing some pushback from sort of very one-dimensional medical experts around that issue, I noticed today. But that was a very reassuring thing, even though it's extremely cautious the way they're going about it. And they've been criticised from the other side for being too slow. But actually, I think they may have got the balance just about right. But they actually have said this is going to be over, actually, and we're just going to have to live with it. And if we'd had a more rapid vaccine rollout, for, you know, I know there are many reasons why that didn't happen, but that could have happened a lot earlier, as it has in the Northern Hemisphere. Yeah.
I guess, you know, we've been through so many phases with this too, which is the shock, the initial shock of what this thing is. Then we've got the we're all in together kind of talk, and then you go into anger and anxiety, and we've been trying to sort of roll through that. It's and there's no real expert on this either, is there? There's smart people, but there's no real expert. But the way we've had to roll has just really knocked us about.
It sure has, and maybe that was inevitable. When you have a once in a century pandemic, just not to blame anyone here, you know, we've done our best. Everyone's done their best to try to deal with it, and people were learning as they go, and no one had all the answers, as you say, and there were different points of view, some of which were completely wrong or you know, overcautious or undercautious. But I mean, you know, we will get through it, but there will be consequences, as you say. It's taken a toll. It's taken a massive toll economically, and it's been disproportionate. So I found a lot of that we're all in this together, and the superficial mental health promotion messages that were put out for a good 12 months or so really started to wear a bit thin after a while.
Yeah, it felt like there was no backup to that, was there? There was just, we're all in it together, and if that all goes to crap, and, you know, there's nothing behind that, you know, was the feeling.
And you know, it's good that they invested in strengthening the helplines, you know, Lifeline and Kids Helpline and so on. But the problem was that they were like sandbags in a flood, and once those sandbags were overwhelmed, there was nothing behind the sandbags, and that's where we come in. That's why I experienced so much direct contact myself, and all my colleagues working in mental health have just been completely smashed.
How are you going, Pat? How do you survive this personally?
Yeah, look, thanks for asking. I mean, I've like everyone else has suffered a loss of well-being. I'm sure, you know, life is not as much. There's not as much vitality or energy or joie de vivre, shall we say? But you know, I'm okay, and I've just, you know, basically been very determined, like I always have been, to try to, you know, strengthen mental health care and work with people to kind of address the problems. And I've just put all my energies into that, and I've had some great resonance with some of the politicians, you know, both federal and state. They have tried to help. I've tried to get them to see the urgency of it, and to put their head above the kind of focus on COVID, and to see that there are other, you know, I've called it the shadow pandemic, and I think that they have tried to do that. So I've just put my energies into those things and trying to do what I can to help other people, and paradoxically, then that helps you to get through it yourself.
Yeah. Look, that's great, Pat. Thank you very much, and for everything that you've been doing, and not just during the pandemic, but for so long now. You know, well done to you and the people around you for pushing so hard. It's incredibly
Oh,
important.
thanks, Justin. Thank you. And look, I would like to acknowledge all my wonderful colleagues and all the people that are working to sort of save lives and futures, as we say, and also the young people and the families who help us to do what we do too, that they actually give a lot back in terms of helping us to do our work too. So yeah, it's definitely worthwhile. And I think we in Australia will have a better mental health system, over the coming months and years. We'll work on it and build it.
Because of this, Pat, you think that will be the stronger thing that comes out of it? We'll understand how important it is?
I think it will help, but I think we have had leaders, and we've had a series of prime ministers that have actually helped to start building the system. None of them have really appreciated the scale of what's needed until I think the Productivity Commission showed the numbers. So it is a tens of billions of dollar issue, that is underinvested in at the moment. And our Victorian Premier and the government here are clearly very determined as a result of the Royal Commission to build the Victorian system back to where it was and to a much better level. So I think better times are ahead, but it's a massive task which no country in the world has ever really attempted.
Good luck to us, I think.
Yeah, good luck to us. Thank you, Justin. That's great.
Thanks, Pat. Good on you. Talk soon. Thank you.
No worries.